Most people lump it, and the truth is 90% of them are probably hemorrhoids, but they are actually diseases such as cancer even. Okay, bleeding could be the first sign of cancer. And in this day and age, many people bring their handphones, including myself, into the toilet. Okay, and sometimes when you're doom scrolling, when you're reading the latest articles and all that, you lose track of time. And prolonged toilet sitting really is an enemy of hemorrhoids.
Really? Yes. What if some people do engage actively in anal sex? What is your take on that?
I think anal sex per se doesn't cause hemorrhoids. If it's directly linked to anal sex, it's more likely to be something called a fissure. It's a tear. It's a paper thin tear.
Right.
Depending on whether lubricant was used, how forceful, how, other details. Details matter.
Hey everybody! Wow, welcome back, and we are now on Doctor Say One Horh. It's been a while of Singapore, not tempura, but now we're back to Dsoh. Today's topic, actually, is about hemorrhoids. And in this room, we've got Dr. Jing Yu. Alright, Doctor, good to see you.
Thanks for the awesome introduction, Josh.
How are you feeling today?
I'm feeling okay, good.
Feeling good?
Thanks for inviting me on.
We love to have you on the show. See, he's a very bubbly, joyful doctor. He's not fierce at all. But I guess when he was an MO, it's probably a different story. Yeah. So doctor, what do you specialize in?
I'm a general surgeon. My specialty is actually colorectal.
Yeah. So how long have you been in this practice for?
I've been a colorectal surgeon for a good almost 10 years. Okay, I graduated in 2008, so I've been clinical medicine for almost 18 years.
You can guess his age by then, I believe, yeah?
Yeah, and the Singaporean guys, the age is very predictable.
Yeah, I agree. Do you have an English name, doctor?
No, I don't.
So Dr. Jing Yu.
Yes.
Did I say it correctly?
Yes, Jing Yu.
Totally cool, eh? So
Yeah.
you're a Singaporean.
I'm a Singaporean.
You served your national service.
Yes, I did.
And
Just like all Singaporean guys.
That ritual, right?
Yes.
Do you enjoy yourself being a medical officer?
I actually had good fun. I was one of the few in my batch who volunteered for outfield, for battalion work. I mean, there are two kinds of people. Some like to do staff work, stay in the office.
Yeah.
I cannot. That's why I became a surgeon.
I see it. And let us dive in today into your current area of expertise, which is hemorrhoids. Oh, sorry, what is it again?
I'm a colorectal surgeon.
Colorectal, right. So you're referring to the large intestine, right?
Yes, large intestine is the anal rectal region.
What's the purpose, the main purpose of our large intestine?
Well, simply put, the large intestine, roughly about 1 to 1.2 meters, is designed to absorb water. So the small intestines absorb nutrients. You cannot live without small intestines. But from time to time, we do have the unpleasant job of removing all the large intestines for other patients, okay, because of medical indications, and they can still survive, but they have a lifetime of diarrhea. Because the function of the large intestine is primarily to absorb water.
Oh, so to make your bangsai hard lah.
Yes, becomes more and more solid.
Wow.
Yeah.
Okay. Solid.
If not, you'll be having diarrhea all day long.
So actually, when someone have diarrhea, right? Then someone like me, even like in the past weekend itself, I felt I had some stomach flu. I just came back from Indonesia. I think I ate something wrong, maybe, perhaps, right? And I had like diarrhea sessions, like I think 12 or 13 diarrhea sessions. I just had it in the past 3 days, right? And then what does that mean for my what's going on in my gut,
I think the most common cause, given your explanation, is what we call traveler's diarrhea.
Okay.
So actually, there's a different bacteria. We all know that the colon is bacteria laden.
Okay.
The large intestine is bacteria laden. And sometimes even the tap water, the drinking water, the place from, Singapore is considered quite hygienic.
Yeah.
Okay.
Yeah.
Developed country. Other country, it might not be palatable. So your intestines are trying to go through a change.
Okay.
A change, and they are not used to this new flora that is being introduced, and that results in some hyperactivity.
Okay.
And that might result in diarrhea. Of course, you might actually eat some dirty food, some contaminated food, and that could be a proper enteritis, a proper food poisoning kind of situation.
What usually is the cure or the simple medicine for all this?
But the truth is that most healthy individuals, we manage to ride it out. So the good old supportive medications, or if you have a fever, some anti-diarrhea pills to slow down the diarrhea, to slow down the colicky kind of the intermittent spasms that you feel. That should do. Just stay hydrated, get enough rest. Most healthy individuals will ride it out.
I believe so. I think I'm feeling so much better already. So now we talk about hemorrhoids, right? So many people hear that word, but they don't really understand it. What exactly is hemorrhoid in simple terms?
Yeah, so hemorrhoids, or what the layman commonly calls as piles or zhichuang in Chinese. Many people are misinformed about hemorrhoids. Hemorrhoids is not a growth. It's not a tumor. It is actually a normal cushions. We all have some cushions around the anus which help to do a few things. I always tell my patients, like fridge, you have those rubber linings. Those are important. They are good seal. Prevent stools, prevent air and all that from coming out. So you do need some form of a seal, some cushions. It helps in the bowel movements. It helps in protecting the muscles. Okay, so when all these normal cushions, all these seals, which are normal in everyday life, become very congested, very swollen, very elongated, they start causing problems.
Just to clarify, hemorrhoids is a body part.
Hemorrhoids is normal in the average human,
Yes.
but when it's swollen, when it's congested, when it gives symptoms, people always use the word hemorrhoids as a pathological condition. And when you have that, it's actually it's a result of wear and tear. Okay, it result of straining, results of pressure, direct mechanical pressure to your rectal area, which results in this swelling.
So hemorrhoid is still it's a condition.
Yeah, I would say hemorrhoids is a condition that is caused by aggravation of a normal anatomy.
But the anatomy doesn't have a name.
We call it anal cushions.
Oh,
Anal cushions that are swollen, we call them hemorrhoids or pals.
Pals,
Pals
right?
is commonly used in the layman.
Right. We have some friends, when they have to pass motion, right, their cushions will come out of the anal hole, right? The butthole.
The anus, yeah.
Yeah, the anus, yeah. So is that okay? And then they have to push it back inside, right? Something like that. Is that okay?
No, that's not okay. That sounds like at least grade 2 to grade 3 hemorrhoids. So when the same tissues, the same cushions have been perpetually or chronically stretched, they lose their elasticity. It's like a rubber band. You keep stretching it, after a while the laxity is there. And when you have to push it back in, it means that yes, mechanically it has grown to a certain size where it is bound to cause some symptoms to the human body.
This pushing back in can increase the risk of it being inflamed.
Yes, certainly. In fact, I will argue that, it is quite severe. In fact, by the definitions of hemorrhoids, we have grade 1 to grade 4. What you have described is already grade 3, where you need to mechanically reduce it. A grade 2 usually spontaneously goes back, spontaneously reduces.
Then in that case, what if the person has no pain at all and no issue, doesn't feel anything about that cushion coming out? In fact, for example, let's say like 5 out of 10 times when they pass motion, it comes out naturally and they just go through life like that. They feel no pain, they feel no issue. What would you say about that?
So one thing that I've found over the course of the years when treating patients with hemorrhoids is humans have this remarkable tendency to adapt.
Okay.
So this is obviously not, whatever you describe is not normal, but they have kind of got used to it that after one good bowel movements, mechanically they just have to push something back in, add an additional step. What happens when you have this, whatever we describe as grade 3 hemorrhoids, if you have prolonged, persistent grade 3 hemorrhoids, very high chance of bleeding, okay? And some patients really bleed out. Because every time you pass motion, they have some bleeding. Over time, they become anemic. Sometimes what happens is these pals can also become what we call thrombose. When it comes out, it becomes very swollen, very inflamed. So there are rainy days and there are sunny days. One fine day, when it's a rainy day, when it's very swollen, it can get caught. It can come out and not be able to go in. And that's what we call prolapse and thrombose kind of pals.
Prolapse thrombose.
Yeah, and that causes a lot of pain, a lot of misery for the patients.
No, or in that case, doctor, what are the early signs that people should watch for, or perhaps they can ignore maybe?
I think the early hemorrhoids tends to present with bleeding.
Okay, bleeding is one.
So fresh painless bleeding is one. Over time, as the hemorrhoid gets larger and larger, as it loses its support, its elasticity, what happens is it starts coming out, picking out from your anus. And that's called grade 2, grade 3. So grade 2 hemorrhoids is actually defined as coming out whenever you pass motion, when you strain, and it disappears quietly. It spontaneously goes back in. That's grade 2. And grade 3, you have to use a finger, actually mechanically reduce it. That will be considered grade 3. So a lump, definitely. And a lot of patients actually have perianal itch because the hemorrhoids, when they are swollen, it produces a lot of mucus, which the perianal skin doesn't like. And it causes this persistent itch that doesn't go away. And a lot of patients misunderstand. They put Dettol, they think that it's a hygiene issue. They put Dettol, they buy over-the-counter creams. Some might work, some might not. Okay, and a lot of all these creams actually contain steroids. So we also don't advise long-term steroids application for the perianal skin. And of course, the last one is prolapse. So bleeding, itch, and prolapse, which you have described just now, they are the more common symptoms of early hemorrhoids.
So the fact that many people actually live with such conditions, they feel okay, they feel fine, and they're afraid to see a doctor. So they just live with that cushions, swollen and hanging out of there.
Yes.
After they pass motion, right? What would you say to that?
I think first and foremost, some of the symptoms can be worrying for other more dangerous things such as cancer. So I always tell my patients bleeding is not normal. Okay. especially if you are elderly. Bleeding could be a sign of cancer, for example, or other conditions. So please make sure that we are dealing with hemorrhoids first. Seek medical advice, especially if the condition doesn't go away, especially if the condition persists or even gets worse. And of course, if the lump, well, really patients, maybe because it's a more sensitive topic, more sensitive condition, and everyone feels that, oh, if I see a doctor, we have to go straight for excisional surgery, which is a tragedy, causes a lot of pain, causes a lot of misery. They shy away from doing that. Hemorrhoids is not so distressing that they have to see a doctor this weekend, or by this week. They can always put it away. There's always another reason, another reason to defer, Yeah, so as a surgeon, definitely I'll prefer if patients with hemorrhoids come forward a little bit earlier. Firstly, to make sure that it's not anything more dangerous or sinister. And of course, if you come at the earlier stage, more options are available on the table, such as minimally invasive options like laser hemorrhoids.
What if there's no bleeding? And what if there is, for example, the person has good life habits, but yet they can still appear with this cushion coming out of the anal hole, right? The anus, right?
Yes.
What would you say about that?
Unfortunately, it does happen. Even it's a bit like high cholesterol, isn't it? There are some people who do everything right by the rule book, but they still have high cholesterol because 70% is produced by your own liver. So some people, because of their connective tissue, they are a little bit more predisposed to such things, even if they live by the rule book. Yeah, but I think, but it's not the end of the world. Get it diagnosed, make sure it's not anything more dangerous, and you can get it treated very easily.
I see. So who are probably most at risk of developing such hemorrhoids?
Hemorrhoids is actually a condition that can affect people across all age groups. Okay, of course, many diseases or conditions tend to be more common in the elderly. Okay, and it's common for hemorrhoids as well because your tissue is a little bit more lax, your muscles are a little bit less tight, okay, more wear and tear if you like. Of course, elderly people have a higher chance of hemorrhoids, but we do see a lot of young people. So pregnant women, for example, I won't use the word trauma, but the entire pregnancy, actually the uterus, the gravid uterus, they tend more to be constipated during natural vaginal delivery, and also a lot of intense pressure around the area.
So we talk about pressure.
Yes, pregnancy is pressure. Prolonged sitting, some people do a lot of weightlifting, increased abdominal pressure. So sitting on a toilet bowl is pressure. Prolonged toilet sitting really is an enemy of hemorrhoids.
Really?
Yes.
Say that again?
Prolonged toilet sitting is actually, it really is a major cause of hemorrhoids among young people nowadays.
So you sit on the toilet bowl too long. How long is too long?
I think the average, of course this differs from person to person, but the average bowel movement shouldn't take more than 10 to 15 minutes.
I agree.
Yeah. There are people who come out half an hour later, lose track of time, or because they keep straining, they keep feeling that it's incomplete. There's still a little bit more, and they keep pushing, and that really aggravates this vicious cycle, of hemorrhoids.
So that increases the risk
of course
of possible hemorrhoids.
Yes. In this group of strainers, actually, a lot of times they feel like there's some stools, but it's actually the starting of hemorrhoids.
In that case, is it even possible that such conditions can be hereditary? For example, say the parents have it, then the children also have it,
I would say that yes, there's an association. If you're, because everyone's, like it or not, is non-modifiable. But if your parents have it, there's a slightly higher chance. I wouldn't say very high chance, but there's slightly higher chance that your collagen, your connective tissue, it's similar, wired roughly the same. So you do have a slightly higher chance. And of course, the other spin to it is that when you live together as a family, you tend to influence each other's lifestyle.
Okay.
Yeah. If you grew up looking at your father or mother going to the washroom and coming out 45 minutes later.
45 hours, wow.
45 minutes. Sorry. And then you think that's normal. And you do the same thing. If you have a low fiber diet, the chances are the entire family goes on it together. So you have low physical activity, the entire family. The lifestyle actually, family units actually do match their lifestyle activities quite closely.
So when should someone see a doctor for this sort of condition?
I think if there's bleeding, especially if it's not self-limiting, if it's persistent, definitely you should see a doctor because or a lump. It might not be hemorrhoids that you're dealing with. And perhaps the most important part about this entire thing is getting a trained medical professional to evaluate and see whether I've been referred cases, patients have walked in thinking they have hemorrhoids and they have other conditions, even had cancer, fistulas, which is another common colorectal problem. So what you're looking at might not be hemorrhoids. Therefore, you might be barking up the wrong tree, giving yourself some false sense of reassurance. And of course, if you feel that over-the-counter medications, whatever you read online, whatever you tried lifestyle, still is not helping, we feel that the condition is getting worse, I think definitely, as a colorectal surgeon, definitely I prefer someone with an earlier stage disease or condition coming in. There are more options on the table. What you have described, the cutting away, is still the gold standard, believe it or not. Over the last 20 years, it is still the gold standard for treatment of hemorrhoids, but it is famous for being painful, and the recovery is actually
ouch,
quite a long period, almost 3 to 4 weeks.
Wow.
Yeah.
So now we talk about the treatment options, right? Can this possible hemorrhoid condition or stages, right, can they go away on their own?
In the early stages, yes. Okay, so I would say if the process has just started, I always tell my patients the most important, regardless of the stage, regardless of severity, regardless of what treatment option you opt for, the most important, the foundation, the bedrock of treatment is actually lifestyle. Lifestyle changes. And what do I mean by that? I divide into the three big lifestyle changes. The first is exercise. Okay. Actually, well, I don't mean heavy lifting, which we just covered just now, but a certain degree of physical activity actually helps to avoid constipation, actually helps to reduce congestion to the rectum. That's why people who are desk bound, who literally sit on their butt the entire day, they tend to have more congestion around the area. There's a higher chance that they might develop hemorrhoids. Yeah, so physical activity is one. That's the first. Number two is fiber. So you think of it as what is the ideal stool to have? The ideal stool is a bit of water inside. You want it to be bulky but soft. When it's bulky, it allows the intestines to push it out easily. When it's soft, it allows it to be pushed out of the anus easily. So how do we do that? Whether soluble fiber like oats or insoluble fiber like some of the vegetables. Yeah, so fiber actually helps to bulk it up. And of course, the last fiber exercise, the last one is water. Okay, I think 2 to 3 liters, average 2 to 2.5 liters of water a day will be sensible. Okay, because it allows, I think a simple gauge we all know is just look at your urine color. Okay, not too concentrated, not too dark. If you're well hydrated, it actually contributes to a healthy stool output. Okay, the entire process is a lot smoother, less likely to have constipation, less likely to strain, which is the main cause of hemorrhoids.
Okay, so when someone see a doctor, right, for example, they see you for this condition that they have about their anus and their cushions, right? What is your steps that you take to assess them, and what do you do next, basically?
I think the main thing is, of course, it always starts off with a thorough clinical history. So some people have, as we just mentioned, not all humans are equal. So I take a careful history. Then I do a physical examination. During the physical examination, I inspect on the outside, and usually we'll insert this lubricated small glass cylinder called a proctoscope, which enables us to visualize better, to see what the enemy is, what degree, how pulse. Number one, is it pulse? And number two, the severity of pulse. Okay, and thereafter, I will size up their risk profile. So the truth is that patients who are above 45, for example, most of them need a colonoscopy, endoscopic evaluation before we proceed with further treatments. I've seen horror stories where you treat the hemorrhoids, which is in your face because it's the closest to the anus.
What?
And we miss out on something more dangerous like cancer that was actually resulting in a bleeding upstream. So basically you treat the side dish and you leave the main dish behind, and that's what we do not want. And after that, based on the severity, based on how much it's impacting or affecting their lifestyle, we come out with I also try to explain to them exactly what we're doing now, how hemorrhoids come about and how we can effect lifestyle measures. And then after that, we choose our weapons. We choose what is the most effective and the safest weapon based on the severity that they have.
In that case, doctor, then what are the differences between the treatment options that you offer for this sort of conditions? So
I mean, it's very early and they just the condition has just started. After making sure that the patient is fine, we are dealing purely with hemorrhoids.
Let's assume there's no cancer.
Yeah. So I think lifestyle works well for the very early stages. As it gets larger and larger, as it gets more and more symptomatic, we can do office procedures such as rubber band ligation. So remember I told you that these cushions are very swollen. So rubber band is actually a mechanical bending. You're placing something to suffocate them, shrink them. I always explain to patients it's like a tree. You're bending the roots. Slowly you will shrivel. Okay. Unfortunately, a lot of times when patients come to seek medical treatment, we are not dealing with very early hemorrhoids anymore. They have kept it brewing for a while, and by the time they come, it's usually grade 3 or sometimes even grade 4. Okay, which is really in your face out. When you strain, one big lump comes out, and in which case we know that rubber band ligation and lifestyle is unlikely. It's like rubber band has already been stretched. Something else mechanical has been done. If not, this problem might lie dormant. It might hibernate for a while, but rest assured you at the right time and the right place, or rather the wrong time and the wrong place, you'll come back and disturb you. So in which case, I will advise something slightly more aggressive. I think we do have weapons now. We do have surgical options which are not as painful. The return to function, the recovery is a lot faster, which are effective for grade 2 to grade 3 hemorrhoids. Some surgeons do stapler hemorrhoid surgery. Some do laser.
But really, doctor, do patients should have a choice on what treatment they can choose? Should a doctor be the one who decide for them?
I always believe that as a surgeon, as a doctor, it is our job to use our experience, our both technical as well as clinical experience to guide the patient. Of course, at the end of the day, the patient makes the decision to proceed or not to proceed. But surgery or medical treatment is a little bit different from buying chicken rice, for example. You cannot just order, cucumber, this and that. You cannot pick and choose and shop. It is our job to advise you, especially if it's dangerous or you feel that it's a gross overkill. Grade 1 piles or hemorrhoids, you want to do a hemorrhoidectomy, for example. Gross overkill, I think it's our job to come in fast, to tell them that this is our concern and this is what we strongly recommend. Yeah, but we also have to gauge the patient's lifestyle. They could be busy professionals. They don't want to, mess around. They just want a quick solution. It might be a retired elderly gentleman who has all the time in the world, wants to be very careful, want to step up all the treatment options one by one. When this one fails, they are migrate to the next one. So really, horses for courses lah. You really have to individualize based on the patient in front of you.
In that case, right, what is the general recovery process of patients from all these treatments?
So I think the answer to that is it depends on what treatment option we choose lah. Okay, if the gold standard at the moment still remains hemorrhoidectomy, which means cutting away. But it is...
that's the most common practice of treatment.
Yeah, I think many surgeons still do that. And we do have to do it. It's still the most effective. Removing the hemorrhoids, because remember I told you it was a mechanical, stretched out tissue. By removing it, it can go back again, but it takes a long time to do that. It's effective treatment. But this surgery is actually quite famous for the pain. This conventional technique, the recovery can take up to 4 to 6 weeks. During that time, the patient might have a little bit of bleeding, might have discharge, and a lot of pain. But in between now, there are many other treatment options. One of the techniques which is gaining popularity in recent years is this laser hemorrhoidoplasty. So we know that it's congested, placing some sutures to pull the tissues back up by using a laser fiber to burn away the engorged vessels. It actually shrinks with time, and the return to function is a lot faster. Generally, my experience is they don't get the kind of intense pain that patients with hemorrhoidectomy undergo. By 5 days, the whole healing cycle almost has set in and they are well.
So if they do recover by 3 to 4 weeks, for example, right, from the usual technique that we still do now,
yes.
During that 3 to 4 weeks, do they face a lot of pain, such that when they pass motion, they always feel pain in the pass motion, or what kind of pain level are you referring to? Yeah,
I think the first bout of stools is famous for being quite painful lah. Of course, healing is a process. It gets better and better with time, and that's why we often ask them. We also give them some stool softeners, because you certainly don't want them to be straining when the wound is there and fresh. We give them some adjuncts like what we call a sitz bath, a salt bath, to try to dry it up, try to accelerate the recovery. But I think generally I will give 2 weeks of hospitalization leave for such patients. 2 weeks for the conventional procedure.
But so if you cut it off, right? Correct. So you're saying that it will grow back again.
Because this is normal tissue that has become elongated and stretched out. So, but I mean, I must say that the conventional surgery, removing the entire thing, it has been shown to have the lowest recurrence. However, you pay a heavy price for that. Okay, and because it's normal cushions, your anus is still there. If we do all the activities that we spoke about previously, you continue to strain, you continue to one fine day, new hemorrhoids or new engorged cushions might go back.
So when you say you cut it off, right, just to be clear to our viewers here, so when you say you cut it off, right, are you cutting off the whole entire cushion, or?
Yeah, it's circumferential, isn't it? So the anus is like a hole. We will cut off the problematic areas. But doing this technique, this procedure, this surgery, it is also very important that we don't cut overzealously, because the anus, especially the skin part of the anus, just as anywhere else in the body, it heals by scarring. And if you cut overzealously, circumferentially, eventually, and I've seen patients with these conditions walking around, you get a very tight anus, ball of scar tissue. They even have this condition called anal stenosis, where they need to be dilated and all that stuff. So with this conventional technique, that is one of the things to look out for. We cannot cut overzealously. Only the problematic cushions, only the problematic culprits. You need to leave generous skin bridges in between.
Right.
Yeah. If not, if it heals by scarring or repeated hemorrhoidectomies like they used to do, actually can result in some very bad outcomes for patients.
Can people possibly live without cushions in the anus?
Can they live? The answer is yes, but the cushions are there to serve a purpose. It provides better seal, provides cushioning of stools, easier to pass motion.
So you talk about pressure, right? Like prolonged sitting and so on and so forth. Just for a side question as well for all our viewers to know also and to hear. What if some people do engage actively in anal sex? Right, anal sexual activity. Will that harm that cushion, or what is your take on that?
Well, that's a good question. I think anal sex per se doesn't cause hemorrhoids. Okay, but it represents some form of trauma to that entire area.
Right.
Okay. And based on how it's conducted, okay, if there's any inherent hemorrhoids, anal sex might not help. It might make the already congested hemorrhoids even more congested and more inflamed. It's like something that is already, if your ankle is already swollen, I keep rubbing your ankle, or I kick your ankle, or keep touching your ankle, it might make things worse. Yeah, but anal sex per se, I don't think it causes hemorrhoids.
So does that increase the risk
of hemorrhoids?
Yeah.
Okay, if it's not violently conducted, I think it shouldn't increase the risk of hemorrhoids.
I mean, it's been in the news before that some people engage in anal sex and they experience bleeding when they pass motion, and doctors say that it's due to their activity of sex activity lah. Yeah. So is that true?
I think if it's directly linked to anal sex, it's more likely to be something called a fissure lah. It's a tear. It's like a paper thin tear. Right. Depending on whether lubricant was used, how forceful, how other details. yeah. Details matter.
Okay.
Yeah. So, but I don't think anal sex per se causes hemorrhoids.
Okay.
Yes.
Okay. All right. Very, very interesting. All right, guys. Now we're here on the myth versus fact section with Dr. Jing Yu. And here we go, doctor. Are you ready?
Yes, of course.
Let's go. So, number 1, hemorrhoids are caused by spicy food.
False. So I think spicy food doesn't cause hemorrhoids. But if you have engorged and inflamed cushions, a component called capsaicin, actually that is not processed by the human body in spicy food, actually aggravates it. So spicy food actually aggravates existing hemorrhoids, but it doesn't cause hemorrhoids.
Hemorrhoids always mean colon cancer.
Definitely false. Myth. As I said, some of the common symptoms like bleeding can be common symptoms for both, but hemorrhoids do not cause colon cancer.
People of all ages can get hemorrhoids.
True, definitely. So as I previously mentioned, people not only of all genders, of all age groups can get hemorrhoids, depending on the repetitive strain of the anal rectal region.
Right. People with hemorrhoids should not exercise.
False. Myth. In fact, I think on the contrary, physical activity actually helps to reduce constipation, helps to relieve venous congestion to the anal rectal region. Of course, certain kind of physical activities like heavy gym activity, all those deadlifts, carrying of heavy loads actually increases the strain to the anal rectal region, which can aggravate existing hemorrhoids.
Well, just to clarify here, doctor, right? When you say exercise for patients with hemorrhoids, what exercise do you usually recommend?
So any cardio exercise, swimming, running, cycling sometimes if it's prolonged sitting on the saddle, especially for uninitiated cyclists, can actually worsen hemorrhoids. But the run-of-the-mill, most physical activities which do not cause a sudden increase in abdominal pressure actually benefit hemorrhoids.
Right. Not every lump around the anus is a hemorrhoid condition.
Yeah, definitely true. So actually many of the lumps that patients actually think is hemorrhoids turn out to be something else. I have had cysts, okay, just a lump there. I have had fistulas, which is another common anal rectal condition. I even had cancers that were masquerading as hemorrhoids in the patient's mind at least.
Masquerading.
Yeah.
Interesting. Next one. Everyone has hemorrhoidal tissue. It only becomes a problem when swollen.
True.
Ooh.
Yeah, so it's normal anal cushions. We all have some degree of hemorrhoids. When it's elongated, when it's swollen, when it's inflamed, it causes problems. It causes hemorrhoidal symptoms.
Next one. Sitting on cold or hard surfaces can actually contribute or cause hemorrhoids.
This is a myth. I think the temperature per se doesn't result in an increased risk of hemorrhoids. However, prolonged sitting, especially on the toilet bowl, does increase the chance of hemorrhoids.
Next one. Hemorrhoids can only be treated with surgery.
This is a myth. The early stages of hemorrhoids, usually we prefer lifestyle. And even the grade 2 hemorrhoids, sometimes we advocate, depending on the lifestyle, depending on the severity, we actually advocate office procedures such as a rubber band ligation. Might not need surgery.
Fantastic. Next one. Lifestyle plays a big role in hemorrhoids.
For sure. True. Yeah, I think lifestyle modifications is the bedrock of all hemorrhoidal treatment.
Last but not least, hemorrhoids are hereditary.
I think to a certain degree, it is not immediately apparent to most patients, but if your parents have hemorrhoids, for example, could hint towards a certain lifestyle within the family, prolonged sitting on toilet bowl, reduced fiber, and also there are people with slightly more lax connective tissue, and that can be to a certain degree hereditary.
Fantastic. Wow, that is just so cool. Okay, now before we go and before we leave this whole entire episode with Dr. Jing Yu, let's summarize today's episode a little bit more, shall we?
Yeah, I think to round it up, first and foremost, not all bleeding, not all hemorrhoidal symptoms are due to hemorrhoids. So I think if it's persistent, if it's getting worse, please get it checked out, okay, with a trained medical professional. Well, how do we treat hemorrhoids? How do we manage hemorrhoids? I think just remember the most important is first and foremost lifestyle. The three big lifestyle measures: adequate hydration, adequate physical activity, and adequate fiber. Okay, so these are the three things. When do you definitely have to seek medical treatment? If the bleeding is persistent or does not stop, definitely you should treat. If the lump is enlarging, not going away, please come and seek medical treatment. When all the over-counter medicines, all the things that you've been putting up with continues to disturb your quality of life, you feel that it's not getting better, your daily life, your routine revolves around your bowel habits, revolves around the toilet, then I think it's good to get some medical treatment, get some medical help, and see whether we can recalibrate and give you back your quality of life.
Wow, you know what? Beyond hemorrhoids, I believe keeping healthy is a very good habit, right? Having great exercise, having a great diet, and having great sleeping habits also, perhaps, right? Are really, really amazing habits to keep up in our daily life. And it's a great time speaking to Dr. Jing Yu. And probably he'll be coming back for another episode next time. So don't go anywhere. Stay tuned. Subscribe here in Med Talk Singapore. And on that note, we also want to say, don't forget to like, share, and subscribe here to Med Talk Singapore, because we are going to bring you a lot more greater stories, insights, information here on this platform. And we love to see you subscribe and your likes and your great comments. They keep us going, they keep us motivated and inspired to serve you better. And also, with that said, we will see you again in the next episode of Doctor Say One Horh. Thank you and good night.
Thank you.